Hello, this is Crystal Watson, and this is my teaching plan focusing on communication. I think it's very important to understand what are forms of communication. Communication is more than just words. Um, and our words are verbal and written. It's also our actions and our gestures. So our gestures are our nonverbal communication. Um, and that is very important when first impressions of people, or maybe when we think people aren't looking at us, that we always stay focused on our nonverbal communication skills, especially when we're in our professional field. My new favorite phrase is the tone is set at the top. I feel that that could be a personal statement, that could be a faculty organizational statement. Leadership can use this. And it is true that the tone is set at the top. If it's your personal statement, then you are the one who sets your tone, and how we communicate our tone impacts how people perceive us, or in the nursing profession, how sometimes people perceive our care. So, what is the effective use of communication? So, when we communicate effectively, we are promoting positive outcomes. Nurses are going to use the correct communication to form a care plan when we're doing our assessments, and especially when we're educating patients, family members, or other um, other nurses, or if you are educating nursing students. So let's also look at poor communication. So the effects of poor communication or lack of communication can lead to misunderstanding of directions, distrust, treatment failure, misuse of equipment, workflow breakdown, and medical errors. So it's important to understand that if you do not fully comprehend or feel like you've received proper communication, it's your job to step up and say, can we go back and relearn something, or can we cover this topic again, so that way you are fully educated on how to properly communicate. So during this learning project, you're going to have some outcomes. After our session, you should be able to describe multiple communication techniques that positively impact patient care, explain the concept of communication and how it is relevant to the nursing theory, demonstrate the use of effective communication when providing patient care. The expectations of this exercise, so this is what we're actually going to be doing, is students will be placed in groups of 4. If there is an odd number, then we'll do 3. Um, or we may have to do one group of 5, just depends. Groups will read over a case scenario. So the case scenario will be in the PowerPoint, but it'll also be a handout as well. So you'll have that hard copy in your hand, or you can refer back to the PowerPoint. That will just kind of depend on what type of learner you are. Each group will identify communication errors within the provided scenario. Now, when you are completing this exercise, the students each individually will be submitting their information. So if you want to do that in a PowerPoint form, as a group, if you want to handwrite, if you want to present verbally, It is the options are endless as long as the expectations and the objectives are met. You're also going to identify communication errors as well as explain ways to improve the communication techniques. And everybody's improvement ideas may be different. Some will be the same, of course, but there may be somebody who comes up with a new type of technique that others weren't aware of or didn't think about. So let's get into our case scenario. Case scenario is that we have a patient, Miss Flo. She's 85. She's in room 4533. She does not have any known allergies. She's a full code. She's been on the monitor. She's sinus rhythm, and she's not requiring any oxygen. She's room air. That's all great. She's currently in PO, and she is alert and oriented times 0. Now, our off-going nurse has stated to us that she is so glad that that I'm here taking over her shift. She said that the patient started around 2:30, trying to get out of the bed. So every 5 minutes, her bed alarm would go off. The nurse would take her back to the bathroom, and all she would do was dribble. So as soon as the nurse got her back in the bed, she'd want to go and get back up. She states that neurology has been consulted because she thinks that something is mentally wrong with the patient. She states that she's so confused that she can't state her name or her birthday. She doesn't even know where she is, and that this lady was going to fall. She also states that she couldn't take it any longer, so she got an order for bilateral wrist restraints. She tells you that the order was put in at 4 a.m. and that the order in MD has not come by to see her, and that will be something that the day shift team needs to address. And she also states that she feels that she has set us up for a better shift. Now, keep in mind, we are in the room the whole entire time this conversation has occurred, so that is something that we need to be mindful of. Now, while we're in the room, you, as the oncoming nurse, during your bedside shift report, note that the patient is tossing and turning in the bed with a slight mumble and you can't make out what the patient's saying. You ask the patient their name with no response and check the wrist restraints for placement and for skin integrity. You also check the patient's brief, you check their surrounding area, and you also check to see if the bed is at 30 degrees. After you leave the room, you go sit down, you check your labs and your vitals. Those are provided here. Some of this information may be important for your communicating techniques or information that you're going to be relaying to other staff or faculty or nurse, doctor, whoever you may need to talk to. You have your patient's past medical history and current orders. You have your past medical history has type 2 diabetes, congestive heart failure, dementia, urinary tract infection, acute kidney injury. You also see that she's had medicine that has been administered since she's come to the floor. She's gotten some fluid, an IV course. She's got some Lantus, and then also a continuous order for normal saline. It also gives you the time that the medicine was due. So now that we've gone over all the information, you have the hard copy with you, or you can look on Blackboard, on the PowerPoint. You're going to form your presentation. Like I said, it could be a verbal presentation. You can create a PowerPoint. You can handwrite it. You can, however you want to present the information. Each person will have a part, and that person will individually select how they will present their information within the same form. So if you say we're going to do a PowerPoint, then you do a PowerPoint. Each person will have their portion of the PowerPoint, but you can deliver that PowerPoint however you see that the information will successfully be delivered. If you want to do just as you're all going to stand and verbalize, that's fine. You may want to add handouts or something to your presentation. Here's your questions. You're going to dig through and find information that's missing from the vital signs. So what kind of communication form will you use there? How do the offgoing nurse's verbal and physical actions negatively impact patient care? Describe the verbal and nonverbal communication that was used. Describe techniques that the oncoming nurse can use to assist the patient in communicating. What other interdisciplinary team members will need to be contacted? What form of communication will be used with the team members? What information needs to be communicated and addressed when you contact that team member? Explain how the nurse will provide updates during the next bedside shift report to the nurse when she returns for another night shift with the same patient. So that's going to be getting into your communication skills when she comes back on how to update her on, let's just say, maybe care that could have been improved. So within this, we're going to use our Bloom's taxonomy. There are 3 separate phrases: your cognitive, which we're going to work on comprehension, which is the ability to grasp or construct meaning from material. Examples of verbs that relate to this function are: you're going to restate, discuss, report, review, recognize, differentiate, identify, and conclude during this assessment. You're also going to use your psychomotor or your non-discursive communication, which is expressive movements through posture, gestures, facial and or expressions. So like I said at the beginning of the PowerPoint, communication is more than just words. How your body exhibits itself also communicates. These movements refer to interpretative movements that communicate meaning without the aid of verbal commands or help. And then we also have your affective, which is in this situation, we're going to use valuing. So this is going to refer to the learner's beliefs and attitudes of worth, acceptance, preference, or commitment. An acceptance, preference, or commitment to a value. So you know, what part of this exercise do you value? What are your beliefs and attitudes towards how communication affects your patient care? Here's the reference. I hope that everybody has a fun time digging through the case scenario and figuring out new forms of communication or enhancing your skills of communication that you already possess.